In this week's video blog, I'd like to go back to the basics and cover what autism is and how to tell if a young child has autism. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author of The Verbal Behavior Approach. I've been doing weekly video blogs for over 2.5 years now, and I just realized that I didn't have a video called What is Autism? Or some of the most basic content that I should have. I'm assuming that a lot of you already know what autism is, but you may be new to the channel. I hope you are. I hope you found your way to me. And if you haven't subscribed to my YouTube channel to join those other 20,000 parents and professionals, I hope you'll do that now. Previously, I have done video blogs on the topic. I have done a video blog called Can You Prevent Autism? Another one, Is it Autism or Speech Delay? Autism or ADHD? And I also highly recommend a blog I did a few months ago on using the MCHAT, the modified checklist for autism in toddlers, that would really be helpful as a supplement to this blog. You might be new to the autism world or to me, or you're worried about a young child, or you might be with me for a long time. And like me, my son was diagnosed 20 years ago, and your child may be older, but things have changed. Things have changed since 1999 when Lucas was diagnosed. We used to use the DSM-4 for diagnosis purposes, and now we use the DSM-5, for instance. There have been changes, and even just the rate increase is a lot more than in the past. So if you want to get more up to date on the latest diagnostic information, I hope to be able to provide some basics right here today. So autism is a spectrum known as autism spectrum disorders, but the DSM-4 back when Lucas was diagnosed included things like PDD-NOS, pervasive developmental disorder not otherwise specified. It included Asperger syndrome and autistic disorder, which were a part of the autism spectrum. And now with the DSM-5, that's all eliminated. So now everyone is known or thought to be having autism spectrum disorder. Now, if you have a child that was previously diagnosed with Asperger syndrome or PDD-NOS, no one's going to, make you stop using that term. It's just not a diagnostic category anymore. So autism spectrum disorder is a developmental disorder with symptoms appearing usually by the age of 3, although diagnoses can come much later. And a lot of times when kids are diagnosed, or even adults are diagnosed, a lot of times you have to look back at, was there a speech delay? Was there repetitive interest and all that stuff from the early on phase? But we're going to just assume that you're worried about your child or some child in your life, if it's a client, if it's a neighbor, a friend, a relative. These are some of the signs in young children that might indicate that they have autism. So the big area of deficit is social language deficits. So that is language that you need for social engagement. Even before expressive language starts, when a young child is even a baby or a toddler, even if they don't have any expressive language, they should still have joint attention skills that start even as a baby. So they should be, early on, they should be smiling at an adult and kind of babbling and cooing back and forth. When they get to over a year, they should be pointing with their index finger, pointing to show you things, pointing to indicate interest. Pointing is a big red flag. Failure to point, to show you things and to want things. And it was a red flag for Lucas, but I didn't know that was a problem. I did do a video blog on pointing, so you may want to check that out. Also, in addition to failure to point, it's low or lack of eye contact, lack of bringing you things to share or show you. And it doesn't have to be 0. It could just be very rarely does a child point, or very rarely do they share and show. Usually a lack of following directions, and expressive language is almost always delayed or abnormal too. They might, like Lucas, take an adult's hand and put that adult's hand on the item they want. That's called hand leading, and that's could be a red flag for autism as well. And also an abnormal reaction to like spilling water or spilling milk. A typically developing child, young child, toddler will, kind of like look at the adult, look at the mess, kind of like, what are we supposed to do about it? Where a child with autism may just smash in the liquids and just play with it. I also have done videos where I've used a screening tool for autism in 2-year-olds and handed little kids, like 2-year-olds, bubbles with the lid tightly closed. And I hand it to them and they're handing it back to my hand, but they're not looking at me like, hey, could you help me out? Could you open these bubbles? They're not babbling. They're not engaging in any eye contact. So at social language, even without expressive language, the lack of pointing and nonverbal communication skills is usually the first sign. There's also impairments, usually in imitation and play. Pretend play is very delayed, and interest, in peers, very delayed. Like other kids, 3-4-year-olds are playing and pretend playing and negotiating language back and forth, where a child with autism is often severely delayed with their ability to navigate the whole system and to share and to play with other children. In addition to language and social deficits, children with autism spectrum disorder also have restricted or repetitive behaviors. This could mean flapping their hands in front of their face. It could be lining things up, spinning of toys or spinning their whole body, obsession with certain items. I had clients who would, wanted all these little figurines and they wanted to carry them around and hoard them. Insistence on sameness, like going to the same way to the store, or when you're in the mall, going in the exact same order, because they like that. They like the sameness. They don't like all the changes that come every day. Children with autism can also be over or underreactive to sensory input, covering their ears, tantruming with change, or when different foods are presented, different looking foods. They don't even have to taste them. They just don't like different foods. Now, I'm saying all of these can be signs, they can be red flags, but it doesn't mean that if your child has delays in any of these areas that it's definitely autism. But they are red flags, and it's always a good idea to be on top of it so that you're not, like I did, sticking your head in the sand and being in denial, because that's really not going to help the situation. The DSM-5, which categorizes autism, also has 3 levels of diagnosis of autism, with level 1 needing just a little support, and level 3 being severe autism with very significant needs. But these 3 levels are pretty subjective, and they definitely can change over time. I've done some video blogs in the past on high functioning versus low functioning. I also did a video blog on, can you predict how a 2-year-old will do when he's older? And the truth is that you can't. So I know plenty of kids who started out looking like very low functioning, very severely affected, and they are doing really well now. Some of my previous clients are learning to drive and go to college and all those great things. And so we can't really predict how they're going to do. And I wouldn't rest on your laurels and not treat it aggressively, because I want every child to reach his or her fullest potential. And that's really the goal. So what can you do if you think your child, grandchild, client, neighbor, friend might have autism? One of the things you can do is download a free 3-step guide, which is called, is it Autism, ADHD, or Typical Toddler Tantrums? And you can get that guide at marybarbera.com/toddler. I'll give you the 3 steps right now. They are knowing your developmental milestones. Know when a child's supposed to sit up, when they're supposed to point, when they're supposed to be putting 2 words together. If there's any discrepancies, I would encourage you to make an appointment with your child's pediatrician and get a free or very low cost early intervention evaluation. If you're in the United States, you can Google your area for early intervention evaluations and you probably can find the number to call. You'll also want to get on a wait list for an evaluation by a developmental pediatrician or other physician or healthcare provider who can diagnose or evaluate autism. And then the third thing I'd recommend is learn all you can about ABA. So while you wait for a diagnosis or more aggressive therapy, you can join my online courses and community. And if you just download the free guide at marybarbera.com/toddler, you'll also have the opportunity to watch a free online workshop. If you like this video, I hope that you'll share it, comment, give me a thumbs up, and share it with others who might benefit. And I'll see you here next week.